Hey guys, welcome back to Medical Coding with Blue. It is Q&A Tuesday. Are you ready? I am totally ready. So let's go ahead and get into the questions. All right, number one. What is the effect of improper coding? Is it frowned upon? Yes, it is frowned upon to do improper coding. However, we are human. We do make mistakes. There is a bit of a learning curve, of course, when you are beginning in the beginning, okay? And even when you are starting in a new clinic, there is a bit of a learning curve, okay? Whenever you are working. The thing about it is, you need to make sure that you're learning from your mistakes. It's understandable that we as medical coders are going to make mistakes because either we're going too fast, we've got something on our mind, we got distracted when we were entering codes in. It could be any number of reasons. But it's very important to be as meticulously attentive to these details as you possibly can. Why? Because it affects the provider, it affects the patient most of all, it affects the facility, it affects a lot of different people along the way. Why? Because we are responsible for the amount of revenue that gets pushed through, right? If we are improperly coding, the provider may not get all of the credit that they are entitled to. The patient may have to end up paying out a lot more than they need to, okay? This is why I tell you guys, learn from your mistakes. Remember the things that you're learning and move on, okay? You are going to get hit on audits from time to time. There are going to be some months where you're going to get beat up because of whatever reason, and beat up meaning figuratively, okay? It's going to be something that you're going to learn because every single person, every single coder is different. The caliber of every coder is always different. This is what I always say. And the reason that I say this is because some of us really apply ourselves and some of us have had more intensive training than others. Some people are just barely getting into the field and they didn't have very good training, but they did pass their certification. So it's really on that coder to make sure that they are continuing to learn so that they can get better each time. So yes, you're not going to get fired if you make a mistake, okay? If you make a mistake, learn from it and move on. It's the careless errors and just the careless mistakes that are going to cost you your job, okay? If you are continually making the same mistake, or if you are insisting that your auditor is wrong, but the auditor is able to provide you information as to why they got the answer that they did, and you're not able to provide something to rebut that, like a rebuttal information to rebut that argument, and you are just wanting to do it your way because you are very determined to have your way and you don't want to be wrong, then you are in the wrong. And I'm being very truthful with you. Learn from your mistake. If the other person is correct, take it as a learning lesson and just keep on going, okay? That's all you can do because sometimes you are going to be wrong. I've had times when I'm wrong too. And sometimes I'm in the middle of a very passionate argument and I think, oh, now I get it. The light bulb goes on. Be willing to admit your mistakes. That's going to make you a stronger coder. It's going to make you more of a leader in your facility. And you don't necessarily have to be in a leadership position. You don't necessarily have to want to be in a leadership position. But being a leader amongst your fellow coworkers is going to make you more confident when you are dealing with alpha personalities, okay? It doesn't necessarily have to mean that you want to take on a leadership position. It just means that you are displaying those characteristics of a strong person that can be able to go up against these alpha personalities. Because I'll tell you what, dealing with these providers, they do have alpha personalities. Some are very nice and some are very arrogant, and you have to learn to work with both sides, okay? I have been successful and I laugh at myself a little bit because it does get difficult sometimes. And I have spent hours training myself on how to deal with different personalities. Sometimes people will come off as very abrasive and sometimes people will come off as completely lost. So you have to be able to cater your response to everybody, okay? I know that's a little bit off track from the question, but yes, just make sure that you are applying yourself and doing the best that you can, okay? We all understand we're all going to make mistakes, but learn from your mistakes and move on. Okay. Next question. How do I become a medical coder? Lots of people are asking me this question. There are two major medical coding associations. The two main powerhouses are AHIMA, the American Health Information Management Association, and the American Academy of Professional Coders. If you want to be a medical coder, those are the ones you want to go through. Now, there is another, AAPC does have a specific credential for billing, if that is what you want to get into. But if you want to be a medical coder, please go to ahima.org or aapc.com. They have their own programs online that you can go to, okay? There is another program out there for just billing. You do not have to be certified to be a medical biller. I just want to make that very clear. You do not have to be certified to be a medical biller. A lot of people can go in to a medical billing company with just a high school diploma and still be able to get a job. You don't have to go through these other programs. If you want to go through these programs, you are more than welcome to, but I am just telling you guys, as a veteran medical coder, you don't have to be certified to be a biller. But if you want to be a medical coder, you have to go through one of the major medical coding associations, because those are the credentials that they're looking for, okay? When you go out into the real world and you're trying to find a job as a medical coder, they're going to be looking for AHIMA credentials or AAPC credentials. So make sure that you pick one of the associations and go with their program, okay? So I'm going to leave it at that. And plus, I have a ton of videos where I talk about how to get into medical coding. I'm probably going to have to do another one, because I have talked about this, but I still get this question. So I want to make sure that I inform the people. So if it's going to be coming out in a couple of days, it's going to be coming out in a couple of days. I don't know. I still have to think about it. So next question. I am changing careers. Will it be easy to get a job coming in from a different field? Okay, so this is a good point, okay? And I'm probably going to do a whole separate video on it. The topic is like marrying your strengths and your skills into being a medical coder. Now, how do we do this? If you came in from not having any sort of medical background, maybe you were working a minimum wage job, you were working fast food, okay? Which is, I mean, I did concession stand before I got into medical coding, okay? I did a lot of things. Medical coding, before medical coding, I did bartending, I worked at a concession stand, I worked at a halfway house, okay. So when you are working in food service, right, you have to be very customer service oriented. It's the same thing when you are working with providers, same thing. You want to charm them, right? Because when you're working in food service, you want to get a tip, right? That's how you make your money. Well, when you're working as a medical coder, you still have to have those people skills and social skills in order to communicate with your providers, okay? So that's how you can marry up that skill. If you were a teacher, in which I've seen a couple of teachers want to transition over to medical coding, great. Do you know what an impact having a background in teaching can do as a medical coder? If your previous job was being a teacher and now you're a medical coder, great. Do you know what happens? You can teach a class. You can teach a class about medical coding. And even if you don't have a lot of experience or experience has been like a long time, it's still okay. Why? Because you know how to develop a lesson plan. You know how to present. You know how to do public speaking. Again, that's marrying that skill with medical coding, okay? If you did a lot of, studying, you're gonna do really well with medical coding, because that's something that you have to be able to do, okay? If you can, what else? There's so many other skills. If you're organized, if you were an organizer at a previous job, I mean, I'm just trying to think of other ones. If you have been in the medical field any part of the medical field. Now, I will say this though. If you're coming in to be a medical coder and you were a nurse before, I'm going to caution you, okay? Nurses, while I love you guys, sometimes you have your nurse hat on when you are a medical coder. You got to change that, because while you get it and while you understand what the provider is saying, if it is not clear, you cannot infer, okay? And I've seen so many nurses have that habit, and it's not their fault, of course. They're nurses, you know, that's their profession by trade. But then when they switch over to being a medical coder, they think, oh yes, I can pick this up, I can pick this up, I can pick this up. And I'm like, no, you can't do that. It says it's probable. And then she goes, well, it's there. No. Even if they're displaying the symptoms, as long as a provider says probable, you cannot pick it up in the outpatient setting. So learning how to take that nurse hat off and put on your medical coder hat is something that you have to really work on. But having a nurse background and being a medical coder is a very good combination, right? Whether you're an LVN, LPN, or any of those, that will really help you, because you've had experience and you understand the medical terminology, you understand what they're saying. And I love that. I love when you can understand what it's saying and it's not clear as mud, but you get it, right? So, but just make sure that you can take your nursing skills, know how to read the documentation, and this way you can help with clinical documentation improvement, which is another thing that I need to talk about a little bit more. Improving the provider's documentation so that it's more clear as to what is happening in that encounter is very crucial. It is so crucial because so many providers do not get taught really well on how to document. It's really kind of up to them, and they sort of get like a real speedy course maybe in medical school. They don't really get taught too much about the importance of medical coding. So it's really on the medical coder or the clinical documentation improvement specialist to really help the provider to understand why it's so important and how to better communicate on paper what's going on with this patient and this encounter. So I'm going to leave it at that one. But yes, look at all the skills that you've previously had from your previous job and work to marry those with medical coding and how you can incorporate that into your daily life as a medical coder. Okay. All right. Next question. How often are you expected to give provider classes, and do you schedule them on your own terms? Okay. So some facilities will have a more scheduled thing with doing provider classes. And provider classes, if you don't know, are basically things that you are going over with your providers. It could be on any topic, okay? Sometimes it's on injuries if you're working in orthopedics, and sometimes it's on proper documentation if you are working in the gastro clinic, or if you're in the cardio clinic, or if you are in family medicine, it is maybe reviewing your preventative medicine codes, right? It could be on any topic that you think is most beneficial to your providers, okay? And how for me personally, there's a lot of coders in my facility that do not like to do these. They don't like to get up in front of their providers. They would just rather do queries or whatever. I am more hands-on. I will go to their face and tell them, we need to do a class. We're going to need to do a class because there's too many of you that are doing whatever you want to do. We need to get everybody on the same page, because I'll have some providers that are doing really well and staying the course. And then I have other ones that are just, it's like herding cats. Okay. So what I like to do is I like to go to whoever does the scheduling, and in my case, it's the chief of the department, and I will talk to him and tell him, sir, I need to get with my providers. I need to get in on you guys' training calendar. They have training twice a month at my facility for my providers, and so they're doing training for whatever. And it's not just the coding, it's other things, you know, that they have. Sometimes they're using new equipment and they need to be trained on it as well. So if they're doing that, then those are the days that they tend to do that. If I request a meeting, then they are very accommodating with me, and they will tell me, okay, whenever you want, we will go ahead and look at the calendar and we will schedule it. When I do find out a time that is appropriate, that I can get it on the calendar, I will go to each one of them because they will get an invitation, right? But here's the thing. They get this invitation, and a lot of times they're not really looking at those things and they just sort of ignore it. I learned that one the hard way. So I was like, where is everybody? And they go, oh, we didn't know that there was a class. I was like, really? No one got this invitation? Oh, we didn't look at it. No. So I had to go and knock on doors. I'm like, guys, we got a class. Come on, you know. They go, oh, really? That's what this one is? So now what I do is, whenever it is announced that I am going to get a class, I do put that in my coding tip of the week. I'll say, hey guys, by the way, we will be having a class on the next training holiday at 12 o'clock or 1 o'clock. I will be presenting on this whatever topic it is, whether it's a refresher. And a refresher is just a sort of list of all the things that I see that are going wrong or that can be improved. And then there's just other different topics. Like if it's aftercare, I'm noticing that it's having a hard time with, then I'll talk about aftercare. So if that's the case, that's what I'm doing. I will, after I send out that email, my coding tip of the week, I will go to each one of them, knock on their doors and say, oh, did you hear about my class? Oh, yes, we'll be there. Or no, I didn't hear about it. Okay, well, it's going to be on this topic, this topic, this topic. And they'll tell me, really, Blue, do we have to? Yes, Blue, we have to. Yes. They start laughing. But they always know it's fun and lighthearted. And they also know that this is a good time for them to ask questions. They also know that I bring in something, whether it's my candy basket and they can just go nuts, or I'll bring something else, just something to make them comfortable while we were sitting there having this conversation. So this way, this stuff can stick a lot easier for them. So that is what I do. The next question is, what should you do with your old books? So like if you have like the 2019 books, and like say for instance you are going to take your test and you have to buy the current year books and you don't know what to do with your previous year books, I like to pass them on to other people who need them. I can honestly say that I have not thrown away a set of books, my CPT or ICD-10 book. I've not ever had to throw them away because I've always found somebody that could use them. So I always pass them along to whoever needs them. Sometimes it's a provider that needs them and they'll say, well, do you have your book? And so when I get my new books, then I'll pass on sometimes my old books to them. Sometimes I'll pass them on to another student, a potential student, somebody who's very interested in the field. I haven't given my provider's books in a really long time. It was like years ago that I did that. But they weren't anywhere near me, and so they needed more access to a book. So I was like, oh, here you go. It's an old book anyway. So yes, do that or recycle them. Don't throw them away. I always feel so bad because there's so much information and there's so many ways to learn, and passing it on to somebody who's perhaps interested but doesn't want to spend money, but then you're helping like the next generation of medical coder. Hey, it's a good deal. It's a win-win. So like I said, either recycle them or pass them on to somebody that could use them. Okay, so that's what I would do. And the next question is, does your employer supply you with books? Yes. We always get issued books every year when the new books come out. The current year books, we do get those. They do give us a choice on whether we want the CPT Professional or the CPT Expert edition. I always pick the Professional edition because I just prefer that one. Some people like the Expert edition. I I mean, it's got a lot more information in it, but it's information that I don't generally use, because the expert edition for CPT, or the procedures, right, where all the procedures are housed, it has like global days and RVUs and things like that. I tend to rely on my coding companions for that information, because coding companions, I love the coding companions. Now, the coding companions, if you don't know, are broken down by specialty, and it will break down all of the diagnoses and procedure codes for that particular specialty, and it'll tell you like just the extra notes about it and the further explanations, what the RVU generation is, and just, it's an amazing book. If you ever get a chance to check out a coding companion, OPTUM 360, this is not an ad, okay, just so you know, but it doesn't mean it doesn't have to be. Hello, OPTUM 360. OPTUM 360 has a wonderful set of books, and they've got sales all the time. That's where I get my books whenever I'm looking for a particular book. I will also look on eBay and Amazon to see what they have, okay? They are really a great source for finding books on medical coding, okay? So, last question. If you want to do independent study, okay, I've been getting a lot of video requests. A lot of requests on what books to get if you want to do independent study. If you want to bypass the schools and the programs online, yes, of course you can study on your own to become a medical coder. I know that with AHIMA, they do allow that with the CCA, or the Certified Coding Associate, okay? They do allow you to just basically not go through a program, but just sort of sign up for the test when you feel like you're ready, and then you can take the CCA, and you know, hopefully you'll pass, you know. If you are going to do the independent route of study, get an ICD-10 book, get a CPT book. The professional edition is the one I recommend. And I will leave the list of books down in the description box, so that way it's, you don't have to write down. Medical terminology, anatomy and physiology, pathophysiology, you need those kinds of books. Medical law, medical ethics, find books on that topic. You want to look up websites like cms.gov, because there's a lot of information on there that would be helpful for you to know and understand if you're going to take this test. If you're going to become a medical coder, the cms.gov, right? cms.gov is a wonderful website, okay? That is the Centers for Medicare and Medicaid Services, okay? That's going to be your big source of information, okay? Something on there is where you're gonna have to look in to make sure that you understand, okay? There's a lot of laws, there's a lot of rules, so you really want to understand that website, okay? Not that that's on the test or anything, but as far as like learning what it is to be a medical coder, that is really going to help you, okay? And that's pretty much it. There's other things as well. HIPAA, you have to understand. Go and find a CCA exam prep book, okay? Go to ahima.org. They have a whole list of specific books on the website that will tell you what books to study with, okay? Specifically, it's telling you on the website. So make sure if you are interested in taking the CCA, that you go on the website and you look and you find those books, or you check them out at the public library. I always say, if you are going to learn something, just learn it as much for as little as possible, okay? Don't spend a lot of money if you don't know if this is really what you want to do, okay? Go to the library, check out anatomy and physiology books. They have wonderful disease process books there that you can read and look up on, okay? But I really do recommend, I highly recommend the CCA exam prep book. That way you can really go through and make sure that you're really understanding what you're reading and looking at, okay? And go to the website and look up all those books, so that way you can use the manuals that they are recommending, okay? So that's it. That's gonna do it for me today. But I will be back later on tomorrow with another exciting episode. But I'm gonna go ahead and wrap this one up. But if you are a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider or a nurse, I invite you to like and subscribe and follow me on my journey in medical coding. And I will see y'all next time. Bye.